was really put together with our partners with a recognition that during the pandemic, there have been so many changes to early childhood education and health programs and services. That includes childcare, home visiting, early intervention, early childhood mental health, child welfare, and pediatric practices. And each individual program, service, and providers had to adjust the way they serve kids and families to reduce the spread of COVID-19. And as programs have faced challenges such as closure, pandemic operations, transitions to virtual services, and reopening, despite our best efforts, the impact of the virus has compromised kids' access to receive essential preventative health care. And as you know, the trajectory of development during the first 5 years, and especially the first 3 years of a child's life, are really creating the foundation of lifelong positive education and health outcomes. And we wanted to create this opportunity for you to hear from the panelists so that as you continue your unique work with children and families, that you have the knowledge and the tools and the resources to support their preventative health as well. So each of you as a professional has a relationship with a child and their family, and brings unique assets to what I like to think of about in terms of the network of support that each child needs to build resilience, grow, and thrive during this pandemic and beyond. And we know and value the trusted relationships you have with children and families you serve. And so this webinar and a toolkit about preventative health is being released in tandem with this webinar. You will receive access to the toolkit. We'll put the link in the chat box, and it'll also be sent to you via email this afternoon. But our panel here today has come up with some very easy to utilize resources and tips to help support preventative health for the children that you care, that you access. For many of us, there may be you may be accessing them before they have a chance to get to their pediatrician's office. So those of you in childcare, many of you who are reopening in childcare next week, you're seeing families before many other professionals have been able to see them for maybe a few months now. And we value and honor those relationships and want to make sure you have the tools so that all your children's needs are being met. So while you continue to serve on the front lines for kids, let us help you support you in keeping children healthy through that toolkit, through our ongoing support, and certainly through the opportunity we have today to hear from the panelists about how you can support preventative health for young children. I'm going to go ahead and introduce our 4 panelists today all together so that we can keep the webinar flowing. Our first panelist is Dr. Michele Dritz. She is a pediatrician and adolescent medicine physician at Cornerstone Pediatrics in Miamisburg, Ohio. Then we will hear from the team of Suzanne Prescott and Sheri Davis. Suzanne is the early childhood director at the Butler County Educational Service Center, and Sheri Davis is a registered nurse and the health manager at Butler County ESC. And then we will hear from Kelly Vyzral, the Senior Health Policy Associate from Children's Defense Fund, Ohio. And like I said, then we'll have an opportunity to address some of the questions that you all will have put in the chat box during the presentation. So I will hand it over to Dr. Dritz, and she'll get us started. Thanks so much.
Great. Hello, everyone from sunny Southern Ohio. We're going to talk today from a medical, at least, standpoint about preventive health care for kids. And I'm going to ask whoever's doing the slides to go ahead and go forward. And this message about preventive health care is becoming so obvious to us these days because literally within the past 2 to 3 months, we've seen a tremendous drop in preventive care, in particular immunizations as a great way for us to measure who's getting the preventive care that we know is recommended and so important to help keep kids and families safe. You can't open up a newspaper or some other journal and not find information about the rapid decrease in childhood vaccinations that we've seen since the coronavirus pandemic. If you can go to the next slide, please. Some of the numbers show us drops in vaccination rates, whether we're talking about vaccination rates for young kids in that 0 to 2, 0 to 5 age, as well as our teenagers. Some of these vaccination rates have dropped to 70 and 80% over the course of the past 2 to 3 months. So significant drops. Here you're seeing numbers just from some of the states in our areas, but we've seen this sort of national trend and these precipitous drops in vaccinations across the board. Next slide, please. As doctors and other providers who take care of kids, we certainly think of those preventive care visits, those yearly preventive care visits, even more frequently for younger kids, as really our opportunity to do a sort of head-to-toe check-in with both the child and the family to see how things are going and really to watch for a lot of important things. And you can see a list of them here, and immunizations is on the bottom of that list, not because it's not that important, but because it is just one of many, many, many things that's happening in preventive care visits, regardless of the child's age. It's our opportunity as providers to monitor for healthy growth and development, to catch potential early developmental delays, especially for our young kids, to check vision and hearing and blood pressure, and all the important vitals that give us clues that something may be up. It's our opportunity to do a full head-to-toe exam and look for important medical clues that may help us give guidance about what may be going on or what issues may be arising. It's an important time for us to screen for things like anxiety and depression and risk for suicide, as well as violence and just other risk factors that kids may be around or suffering from. It allows us to really make sure kids are ready and safe for things like sports participation and childcare attendance in school, and to monitor for important risks like substance use and vaping and bullying and STIs and violence, and a lot of important risks that can come up at various stages of development. It also allows us to monitor for chronic medical conditions and renew prescriptions and services that many of our families need in order to stay healthy and to stay at their best function. And it's a really important opportunity for families and teens and kids and all of those participating in the well visit to ask important questions, and for us as providers to help address concerns that the families and the children may be having. And to complete things that we know are also important at certain ages. Sometimes there's important health screening or labs that needs to be done and recommended at certain ages, and immunizations at certain ages, and really an opportunity for us to provide guidance and support for health and wellness, both now at this age, as well as those habits that are being set in motion for their health long into the future. Next slide, please. And we recommend a lot of well visits, especially in the first few years of life. You can see all of those little arrows are pointing to a recommended well visit over the course of our sort of childhood and pediatric life, including even the prenatal visits in there too, because those are important for that development before birth. But you know, it's a good reminder for all of us to recognize not only are those well visits recommended and important in those early ages that we typically, I think of them, you know, those babies and, you know, all the way up to about 5 years old, but are still recommended once a year from that point forward, all the way on through childhood and adolescence, and even for adults. And those visits I just showed you are some of the things that we do during those times, but immunizations, like I said, are an important piece that happen, especially during certain critical ages of those well visits. So you can see on this slide that 0 to 5 age range, which is certainly in the wheelhouse of many of you in childcare facilities, are a lot of immunizations that are done to help prevent illnesses both at that time in life as well as for those children in the future. Then again, at that 11 to 12-year-old mark, there are immunizations that come up again, helping to protect children both now from illnesses as well as for their future health. And then 16 as well. And that's not even to mention the yearly flu vaccine that we recommend every year to help protect our kids and adolescents. Next slide, please. And we say that these well visits are important for everyone because there are different needs that come up at different stages in life. And I don't think you need me to tell you that, because I think it's intuitive that we recognize that the things that we maybe struggle with more at certain ages shift as children age, become adolescents, move on to adulthood, or trying to transition to adulthood. So there are really important key features that we're keeping an eye on, monitoring, really helping support families with all along the trajectory of growth, whether we're talking about our infants and babies and toddlers, or school-age children, or teens and young adults, and eventually transitioning to full adulthood. And for us, our family, us to model that healthy habit of going to our own yearly well visit, because our actions often speak louder than our words. Next slide, please. Next slide, please. Thank you. So I think one really important role that all of you who work with children in childcare centers and in other capacities can certainly help support families with is helping them understand why those preventive care visits and the immunizations that go along with them are so important, and helping us certainly get out the message as to how we as medical providers are doing everything within our power to keep those children and families safe, to keep you and your children safe as well. There's been a lot of changes and emphasis on increasing even more so clinic cleanliness and infection control procedures, specifically thinking about coronavirus, revising clinic and screening protocols the way that helps us protect you and your family from infections, preparing our waiting rooms and exam rooms for new ways of caring for you and your families, oftentimes separating out when certain patients come in so we can keep as much infection controlled as possible. We're implementing safe ways to keep healthy patients separate from those that are suffering from coronavirus or potentially suffering from coronavirus. And we're trying to send the message out in all the ways that we can to families to say that we're open for care and here for to support. We're also trying to reconfigure our appointment processes so we can help get families in for the needed care that they need. Immunizations, preventive care, all of those things that we've seen plummet over the past few months, but are so important, especially as they're getting ready to start back up at school in the fall, and childcare and sports, and all of those important things that need to be done every year and assured to be done completely. We're trying to make the most of every visit, even before this pandemic, but we certainly keep an even stronger eye on that now, watching for anytime we're seeing a patient in the clinic, if they're due for immunizations, are they due for preventive care? What can we accomplish then, and what can we sort of pull together in order to give the very best care as possible and as efficient way as possible as well? We're trying to help families understand that yearly well visits are really important, and especially for our adolescents and sort of childhood ages, that those well visits include all the components that would naturally be part of a sports physical too. So again, with an aim of really helping families be as efficient with their time, so they're not going to multiple places to get a well visit and then somewhere else for a sports physical and everywhere else. All of those things are part and parcel with that very comprehensive well visit that you saw me show a moment ago. And we're really trying to continue to optimize our appointment types so we can use telehealth when it really is one of the most effective ways to provide care, but also help bring patients into the clinic when we know that part is so important in order to give the type of care that we need, especially for preventive care visits, where that physical exam is a really important component of that visit. Next slide, please. And then lastly, I'll just put in a plug for what the Ohio AAP chapter is doing, not just for the individual clinics and the the care for the patients that we see in our individual clinics, but for all of Ohio's babies and kids and teens. And I believe some of this information is in that toolkit, but you can see lots of different resources for you all, for your own personal use, as well as for the use within your child care centers and businesses and organizations, to help get the important messages out to family about how to keep them safe, and how we as pediatricians and you as other adults that work closely with families and kids can help us keep all of our children in Ohio safe. So thank you very much. I think that's my last slide.
All right, great. Thank you so much, Dr. Dritz. And we're going to transition to Suzanne and Sheri from the Butler County Educational Service Center.
Great, thank you. Well, I'm Suzanne Prescott. I'm the Early Childhood Director. And just to give you a perspective from a director point of view, Sheri and I also have a slide here that has our emails on it. If you have questions about anything, feel free to contact us afterwards. I just really want to talk from a director perspective, how important it is, and you can move to the next slide, the relationships. I'm so glad that I had some relationships in our community. So wherever you are, with different segments of the people who we need to lean on during this time. I have found the health departments in our area to be very open to helping us with phone calls and anything that's going on with us, to be able to reach out, and they really want to help. We have a plan in place. We're going to send it to them. And they sit on our health advisory, which they are more than welcome. And we really value their input as we're looking to reopen and what do we do for kids and families. But they're really a valuable resource, as well as, you know, your providers. You have some main providers in your communities, some big ones, reaching out, the relationship we have with them and reaching out to them to know what's going on. Who are they serving? How are they serving them? Because often we find when we just give our families a number, that's one thing. But if we can say, here's what's going to happen when you call, here where if we know where they're open, or how it looks different depending on the provider. And that has been super important for us during this time, so that we let parents know the details. You're going to call here. You're not going to go to this office now. You're going to go to this office where they're seeing kids for well child visits. I will also say, as a provider too, if you have a family you're struggling with, please don't hesitate to call. If they're a birth to 3 child, don't forget the state of Ohio has Help Me Grow. And if you have a child that has some health problems, that are having a problem finding a provider or getting their getting some health care coverage, or a young mom who needs some support, don't hesitate to call the statewide number for Help Me Grow and refer that family so they can get that extra support that they might need. And then I recognize that not everybody has a nurse on staff, but almost everybody knows a nurse. I don't know a nurse who isn't staying up on COVID-19 and what's going on with that. And I can tell you, the years when we didn't have a nurse around, I had a friend, I had a confidant that I knew that I could always call and go like, okay, I don't understand this. I would say your health departments are also a good resource for that. I just don't understand this medical piece. Can you help me understand? And so that you can then move forward with planning with that. So don't hesitate to reach out to any of those resources to help you with the kids during this time. I'm going to send most of my time to Sheri, because I think she's the nurse and she really gets this even better than I do.
Thank you, and welcome everybody today. So Suzanne touched on something that I really think has been really valuable to our program, and that's our health advisory. I highly recommend that you reach out to your Head Start programs and find out where their health advisory is and see if you could get an invitation to that. Our health advisory pulls all kinds of community resources in. We have our federally qualified health center there. Our local children's hospital is there. Our Medicaid providers are there. WIC comes to health advisory. This is a chance for you to network and get those resources that your families desperately need through this time. So it's already set up for you. You just have to get an invitation to your health advisory and show up. It's not a huge commitment. They probably meet 2 to 3 times a year. And then you've got your contacts already set up so that you're able to connect your families to the resources they are asking for. Go ahead to the next slide, please. And considering their perspective, I saw many times in the chat box, people were talking about that well childs were getting put off. They were getting calls from their pediatricians asking them to reschedule or actually closing the facility. You know, I understand why this was desperately needed. Ohio had to shut things down quickly. They had to assess where they were before they could allow things to reopen. But when a parent or a caregiver sees something being shut down like that, their perspective goes to, it's an unsafe place for my child to be. So right now we have to gain that trust again. We've taken a couple steps backwards in this area. They're afraid to bring their kids there. It's not because they don't want their kids to have these things. It's not because they don't love their kids and they don't, want the best for their child. It's because they're scared. So when a parent comes to you and they want to know, is this a safe thing to do? Should I be doing this? You need to help them with that next step because they're just frightened. So come at it as a non-judgmental, empathetic person and listen to what they're telling you and then help advise them. But it's not because they just don't believe in it or they don't understand it. They're getting a lot of misinformation. There's a lot of scary stuff on the news. There's a lot of scary stuff on the media. They're now, they're talking about the inflammatory disorder with the children. That's less than 100 kids that are being affected by that. But as a mom, you hear that one kid died and, you blow it way out of proportion. So being that person that can actually give them good information and making sure that your resources are correct, you go to the CDC, you go to the Ohio Department of Health. Don't go to crazy resources. Make sure your resources are good and valuable and giving you the correct information. There's enough misinformation out there. You don't need to provide that for the parents. I have one of my favorites up there, which is PA4V. It is actually Ohio Parents Advocating for Vaccines. They have wonderful videos that really kind of talk to the parent to help them with the myths that are going out there with vaccines. And then, of course, the Ohio Academy of Pediatrics as well. Next slide, please. The first thing we did as an organization when the pandemic hit and we heard that they were asking for health clinics to shut down is we called them. We called Cincinnati Children's, we called Primary Health Solutions, we called Centerpoint. They were our biggest institutions that deal with our kids. And we asked them what they were doing. What are you doing to keep kids safe? How are you handling well child? What should we be telling our parents? They were more than happy to give us that information. Feel free, call those doctors' offices that are close to you, call the ones that you know that your parents are utilizing and ask them. What is it that we need to tell our parents? What are your hours? How are you keeping them safe? That's exactly what we did. And then we started getting that information out to our families as quick as possible. Next slide, please. Then we actually targeted specific kids. So we looked at our medical information on our kids. If we found them to be high risk, maybe they had uncontrollable asthma, seizures, any kind of medical diagnosis that we were concerned about, we called those parents to make sure that they were keeping their appointments, that they had appropriate medications, that they weren't running into health issues that they were concerned with. We got those addressed as quickly as we could. Then we targeted our kids that were behind on vaccines. We know that they need to get their vaccines. We know they're going to be going into kindergarten soon. They need those vaccines to get into kindergarten. So we started calling them and targeting them, just having those phone conversations with them to let them know that this was something that they needed to take care of. Try to give them that gentle nudge to go ahead and feel free to get those things taken care of. Next slide, please. So use the resources that are credible. We kind of talked about this. The other one that I really like is Nationwide Children's Hospital. You can go on their website. They've got an entire website dealing with just COVID-19 in children. So go to credible resources to get your information. Next slide, please. And again, join your health advisory. If you're having trouble finding your health advisory, let me know, because I could always allow you into ours. We'll Zoom you in or however you need to get in, but we want to make sure that you get those resources, those credible resources that will actually help facilitate what's going on with you and your families. Next slide, please. And that's it. So thank you very much for your time.
Thanks, Suzanne and Sheri. And now we'll move on to Kelly from Children's Defense Fund. Thank you.
Hi, thank you, Lynanne and Groundwork for inviting us to participate in this, and thanks you to everyone who's tuned in. CDF Ohio is going to talk a little bit about keeping Ohio children and families healthy and how to access benefits for the children that you're working with. Next slide, please. So we know that COVID-19 is all over the place. It's reached all 88 counties in Ohio, and it is shut down. At one point, it had shut down the entire state. There are 1 million unemployment claims in 8 weeks. And what are some of the things that Ohio must be doing to keep these families and children healthy and stable? We believe they need to be supporting new enrollments, ongoing coverage and services to Ohioans. No one should be losing their Medicaid coverage at this time. And the state of Ohio has gone to CMS and requested the ability to make changes to their state plan so that they are holding off on any kind of revalidations or kicking people off of Medicaid. They've done away with their copays for right now during the public health emergency. They need to be prioritizing services to protect children's health and maintain public health. They should be expanding access to healthcare shortage areas of the state. And they need to focus on vulnerable populations. Next slide, please. Oops. Okay. So the first thing we're going to look at is enrolling in CHIP and Medicaid. You have your eligibility groups, the low income, that's 133% of poverty, pregnant women, infants, and children's, up to 200%, 206, I believe. Also youth in state custody and in the child welfare system, and their access to the Bridges program as they hit the transition age, individuals with disabilities, and certain categories of immigrants lacking documentation. Medicaid right now is playing a major part in keeping families healthy. There are almost 2.6 million children in Ohio, and 1 in 5 children were living in poverty before the pandemic hit. There are approximately 1.3 million children in Ohio that are covered by Medicaid. 100,000 children being raised by grandparents, 1,000 youth that age out of foster care each year. And we have 115,000 people in Ohio that were born in the United States that live with at least one undocumented person in their family. During the same period, 1% of children in the state were citizens living with at least one undocumented family member. And in 2016, 59% of DACA eligible immigrants in Ohio had applied to take advantage of the DACA program. So we have a large population of immigrants in Ohio, which is a wonderful thing and adds to the diversity that makes this a wonderful place to live. But during times like this, they are often the ones who are closed out of being able to easily access healthcare, and in a time of pandemic, that becomes a big problem. Next slide, please. And I believe go on to the next one. I double slided that. Sorry about that. In Ohio, children that are covered by Medicaid can access the health check services. This is Ohio's EPSDT program, the early periodic, I do this every time, screening, diagnosing, and testing and treatment. So these are critical service packages for babies and children. There are 12 checkups a year 12 checkups in the first 2 years, and then annual checkups after that. Comprehensive physical examinations that you heard about before. Ohio has adopted the Bright Futures recommendations for vaccinations. And according to the Cleveland Clinic, Ohio has seen a significant drop in vaccinations since the start of the pandemic. Depending on the area of the state and the vaccination that you're looking at, it could be anywhere from 42 to 73% decline compared to the weeks leading up to the pandemic. And that's important because COVID-19 will wax and wane, but if we don't have these kids getting their vaccinations, you're going to run into other problems with measles popping back up, or mumps, or chickenpox, or all of those things that are completely controllable will start to reemerge if these kids aren't getting their vaccinations. Next slide, please. So families accessing services. Each of the managed care organizations, and if they are enrolled in Medicaid, they are most likely in a managed care plan. They all have lists of providers that can be accessed. Each county has a health check coordinator that can help families access healthcare and get those needed healthcare services. Ohio Medicaid has a consumer hotline that can be accessed. As we heard about before, the federally qualified health centers are such a huge and important part of this. By helping families who don't have insurance or who cannot access Medicaid. School-based healthcare centers, the Medicaid in School program is very important. And also the state of Ohio during the COVID-19 emergency did expand their telehealth rules to allow some of those child well check things to be done through telehealth. Of course, they can't do their vaccinations that way. They do have to go in person for that, but you know that we have some drive-up clinics, we have curbside things, and then these being able to be taken care of through telehealth, which is, I think, something that should be looked at to make permanent as a part of Ohio. Healthcare would be a great idea. Next slide, please. So Ohio has 56 federally qualified health centers in 70 of the 88 counties, and they've served 850,000 Ohioans last year. Most of them are open to all Ohioans, regardless of insurance status or ability to pay. They provide medical, dental, behavioral health, pharmacy, vision, and other needed services. If they don't have some of the services on site, they will absolutely give referrals and help people with transportation and getting to their appointments. During the COVID-19 pandemic, these community health centers are serving people with telehealth. And as I mentioned before, your drive-through care. The CARES Act, which was one of the federal bills that were passed to help with this pandemic care, provided $40 million to Ohio's health clinics, which is a great help, not enough, but certainly is very helpful. Next slide, please. Another group that everyone should be concerned with during this time is transition age youth. We know that these kids have a lot of challenges going into it. They struggle with employment, they struggle with education, they struggle with homelessness. If they are aging out at 18, they do have access to the Bridges program, which is an extended foster care, which allows them help finding it's job training, it's help finding a place to live, help with schooling, getting them enrolled in whatever type of extended education they'd like to participate in. The state of Ohio did waive the work and school requirements during the pandemic, and it also extended foster care so that if they're not in the Bridges program, but in foster care, they can stay in past their 18th birthday through the end of the public health emergency. So that is a great way to help keep these kids stable. But they're particularly vulnerable at this time because they don't have those strong family ties or mentors to fall back on. And next slide, please. And finally, one other option for families is emergency Medicaid. This is available to individuals lacking insurance coverage. As the name says, it provides emergency services to individuals who would otherwise not qualify for Medicaid. It doesn't require a Social Security number or an ID to qualify, and is used by many health centers to provide care for undocumented children and families. 8% of all children in Ohio live with a parent who is an immigrant to this country. During 2016, that was over 200,000 children. And during a pandemic, it's particularly important that every resident of Ohio has access to health care. Next slide, please. And that's it for the Children's Defense Fund. Here's some contact information down there if you have any questions or comments. We'd love to hear from you. Thank you.
Great, thank you, Kelly. I want to address some of the questions that I've been seeing popping up in the panel. The first is really about some different messages that folks are hearing in the community, child care centers, parents and families in terms of rescheduling well visits for those families that have missed well visits during kind of the shutdown period of time or over the last few months. I'm wondering, Dr. Dritz, if you can just reinforce this, but my understanding is the Ohio chapter of the American Academy of Pediatrics advises that well visits can be and should be happening at this time. And so I wonder if you could speak to that to just clear it up for the folks who are on the line in terms of supporting families and making the choice to go to well visits.
Yeah, I would definitely say above and beyond the Ohio chapter of the American Academy of Pediatrics, pediatricians are trying our best to get that message out now. I think we've, over the past few months, really been trying to strike this balance between, the risks for individuals to get infection and the public health risks. That is the reason why you've seen the types of messages that have been so strong and so across the board for the months leading up to this. I think now what we're certainly doing and seeing in Ohio is trying to shift part of the messaging back to the importance of continuing to keep an eye on public health, recognizing all that we've learned to help keep people individually healthy and safe. And we as pediatricians, what role at least we play, a small part in that, in helping to keep them safe by getting those preventive care services back going, including immunizations, as is already mentioned, is so important to help prevent other types of outbreaks from happening as well at the same time. So if you haven't heard from your pediatrician's office, and especially if you know that you're overdue or you have children or children that you work with are overdue, I would say give the offices a call. Most offices have sometimes between 2,000 and 10,000 kids in their offices. And so they're trying to get messages out in mass sort of ways, but they may not have reached out directly to families yet individually. So certainly feel free to give your office, local pediatrics office a call or family practice office a call to try to get scheduled for your appointments. We're trying to be creative though as well. So sometimes we're specifically having patients come in maybe just for immunizations for like a short little type of visit, and getting that preventive care services done in a different way a little bit later on, because again, we're trying to get lots of catch up here too. But the message that I would leave you with is we have created safe environments for families and kids to come to for the care that they need, not just the care that they need when they are sick, the care that they need when they're well, and we want to help keep them well. Is call to schedule appointments if your doctor's office hasn't already called to schedule one for you.
Thank you, Dr. Dritz. And I think knowing, kind of hearing from a lot of primarily childcare providers who have been open during the pandemic and now many more who are reopening next week, just as that industry has created a path forward to building trust and ensuring that children and families and staff will be safe. Clearly, pediatricians in our state are doing the same. And so in order to help, I think we all want to help each other among the various professions best serve kids and build that trust. And I just want to point again to the toolkit that we released that was referenced in the chat box. A couple of really tangible tools that are there include the postcard that the Ohio AAP has created about the importance of well visits and that gentle nudge to families to say, hey, it's safe, it's time, like let's get you caught back up, let's get you back in the office. And that may be just a great easy material to include in your family's materials that you're giving to them as they either enroll back in your program or you're meeting them at the door for the first time in a few months. The second piece is a letter. We drafted a template letter. So if you would like to communicate with your families about this, we have a simple template and have contemplated that many providers, especially childcare providers where vaccinations are required, are going to need to start somewhere in terms of making sure that their children are caught up so that there's no interruption in care. So hopefully those can be utilized and be a helpful starting point for some of you. There have been a couple questions around in the panel, really around wanting some opinions around best practices for childcare providers. And in the chat box, we are linking to what the Ohio Department of Job and Family Services has put out thus far in terms of childcare rules, what is mandatory versus what are some encouraged best practices. But I will say if Dr. Dritz, I guess if you have any opinion or message that you may want to share, and then Suzanne and Sheri about some of the best practices that you are deploying or you are seeing deployed that you are really proud of in your community. And there was a specific question about footwear and the removal of footwear in and out of offices. So I'll let you take that. I know we can't get into a lot of detail here, but folks are curious. Oh, you are muted, sorry.
I'm muted now. First of all, I will say that, and I wasn't clear earlier about this, but some of the practices that I'm going to tell you that we do in pediatric offices really can translate also to our child care centers. The fact that we are trying to keep certainly kids that are separate from those that are well, in the way that we schedule appointments, what time of the day they come in, what exam rooms we use, things like that, that may not be completely applicable to child care centers, but it's things very specifically like that certainly we're doing in pediatric offices. I think more from a child care setting environment, you are talking about a slightly different environment there. One, especially for our very young children, less than 2, we don't recommend having masks on them. And we don't recommend fighting tooth and nail for our 3 and 4 and 5-year-olds as well. And again, that's because what we're doing is, again, striking that balance between an individual person's risk, especially a child's risk for infection that we've seen now as we've gathered more and more information about the risks that this COVID pandemic has shown us, and compare that to the public health risks as well. So some of the practices that I've seen put out by the CDC and the Ohio Department of Health are really around being smart, like thinking about your child care classrooms, one, being small to maximize space for kids and teachers to move around in, to be really thoughtful about cleaning, washing your hands, most importantly. That's the most important surface to clean regularly, but also clean high touch surfaces like doorknobs and light switches and things like that. But just really being thoughtful about trying to minimize interaction between other classrooms and keeping it sort of within a single classroom so teachers aren't moving around as much and kids aren't moving around as much. The information that we've figured out so far in terms of the risk that this infection poses in terms of how one passes it along is primarily talking and sort of the droplets that come out of our mouth that way. So though we can't say that there's never any viral particles left over on surfaces or cardboard or things like that, that's luckily why we talk about a lot of washing of surfaces. But we also need to live life, and we also need to be able to provide a really enriched environment for children as well. So that's that balance between striking what is the absolute 100% way that we're going to be able to stop the virus, and that is keep us all in a bubble, versus how do we start to bridge that gap that lets us to still meet all the very important needs that people have and our children have, with the risks that the infection itself poses. Because part of that risk that the infection itself poses is more to the healthcare system being overwhelmed than necessarily an individual person.
We are looking at this issue. We haven't really landed where we're going to go with the shoes and that piece. But we think even in a preschool classroom, our kids are down on the floor playing a lot. So Sheri and I have been bantering this around. You know, do you see some videos caring for our children has suggested, you know, that maybe shoes are a big deal. So possibly having kids take their shoes off outside the classroom, having a clean pair of socks that we can wash for them as they go in the classroom, so that when they're down on the floor, because that's what kids do, right? They get down on the floor. Another idea we have is we're going to buy hula hoops for kids so that they can grab their hula hoop and have their space. It's just 36 inches. So if there's another kid next to them, that's, you know, we're getting close to the 6 feet. It just needs lots of visuals with still having that classroom so personal, and, you know, that play. And we know we're going to see kids in more parallel play than with each other because of trying to do the distance, but it's going to be a lot of work. But that's just kind of one of our thoughts that we may do, is do some clean socks to get kept in the classroom, and then nobody's shoes, you know, become a big deal.
Thank you, Suzanne, and thank you, Dr. Dritz. We referenced in the chat box, again, Ohio Department of Job and Family Services kind of recommended and required practices for childcare. They've also created webinars, and I know that they've worked with some small groups of providers to be able to help articulate and communicate what so many of you are all doing feverishly in anticipation of reopening, which is actually what you are really good at, which is being creative and meeting the needs of kids and families and really just doing your best with what you know with what you know now, and continuing to be flexible. So thank you. Just very quickly, you deserve more time than this, but thank you for what you are doing. You have been asked to do some incredible things over the past few months, and we know that you will continue to do so. And please know that for those who have hosted this webinar, and for Groundwork Ohio in particular, we have your back, and we've been at the table advocating to get you the resources and the information as quick as possible. And we are thinking of you and supporting you in the ways that we are able through advocacy. I haven't seen any other big questions in the chat box, so we have just a few minutes left, and I'm going to go ahead and wrap up with some next steps. You have a lot of resources or additional tools in your tool belt after listening to this webinar, so please go ahead and download the toolkit that I shared with you. Again, the link is in the chat box. From an advocacy perspective, you can join Groundwork Ohio tomorrow. We're having a panel discussion with Congressman Steve Stivers and Senator Stephanie Coonsey. The link in the chat box for that roundtable discussion is there. We all are hungry to continue to hear from leaders about where they stand on childcare, and are utilizing this opportunity with a panel of folks including childcare providers, Head Start, and our R&Rs to be able to communicate the great or grave loss of capacity we're facing in terms of childcare, and the resources that are needed to support all of your work during this time and stabilize the system into the future. So please join us then. The last is we'll send you a link in the chat box. We wouldn't have a webinar if we weren't asking you as advocates to connect with your policymakers to elevate the importance of investments in early learning and health during this time. We need everyone to view themselves as advocates during this time if you haven't in the past. Advocacy is our full-time job. You are caring for children and families full-time, so let us do the hard work or the heavy lifting, and provide you with very easy ways for you to engage in advocacy. So if you have 2 minutes a week to spend with us, you can be an advocate. So the webinar, the current campaign that we're running is a Twitter campaign. So if you have either your personal or organizational Twitter, we are tweeting at Senators Brown and Portman and asking them to invest more dollars in childcare in the next federal stimulus package, so that there are more resources to adequately meet the needs of childcare programs and children and families accessing childcare in our state. So the link to that campaign is out there. It only takes a minute. I said 2. It might take 2 in a different tool we have in a different week, but this week it's 1. So please join us. And just a reminder that the webinar recording, along with all the links posted in the chat box, will be uploaded to our website today at groundworkohio.org/COVID-19 webinars. And again, I know some of you are going to be asking about that Ohio approved credit. You will receive an email with a link that you need to access by Friday at 5 to make sure you get credit for the hour that you spent with us. So thank you very much. Thank you to our panelists. We're grateful to have the expertise in Ohio to help keep guiding us to do the next right thing for kids. And I hope you all enjoy the rest of your afternoon. Thank you.